Hey everyone, welcome back to the show. It's your host, Dr. Kappas, today joined with Dr. John Whittle. Thank you for joining us today.
Yes, very excited.
And we are talking about genomics and TBI and stroke. So this is going to be a really interesting topic for me, and I know the rest of our listeners, so I'm really excited to dive into it. Before we do that, though, Dr. Whittle, could you tell us a little bit about who you are, maybe where you practice, and how you got into this particular field?
Sure. So my name is Dr. John Whittle. I've been in professional practice this is my 25th year. When I was in chiropractic school at Life University in Atlanta, Georgia, I was a little disconcerted with chiropractic in general because it was a little too simple for me. And then I did actually an applied kinesiology seminar, which kind of looked at the whole picture and got more into nutrition and what's wrong with the body. And this is before functional neuro even kind of came about. It's in an infancy state. A lot of the functional medicine was too, and it was kind of my go-to. But that was my start, and then I've just expanded over the years. As I did more nutrition and neuro and functional medicine, and I've kind of ended up if you will, here in genomics, which is kind of the end all. And our genetics is who you are. It's the one thing that doesn't change about us. But it's a massive, massive topic. And it's a really good topic because it's humbling because you can't know it all. There's just too much data points and no human is capable of actually doing everything. So that's where I'm at the
Great.
point.
And then could you define for us what exactly is genomics?
So genomics is really looking at mostly the nutritional organic components to genetics. We all have our genes. You can't change who you are. That's the nice thing about genes. It doesn't care what race you are or what religion or what anything. It is what it is. And genomics is looking at that. And then when you find where you may have imbalances, weaknesses, and strengths, you also know what to look out for in the future. So if you have a lot of diabetes on both sides of your family, from genomics to, hey, I really need to watch my blood sugar. I really need to exercise properly. I should take care of things. So you get a lot more compliance and understanding from people when you do your genes.
And so you wanted to talk about how that then relates to TBI and stroke, which are typically considered acquired conditions. So how do genes then play into those two?
Right. So I actually got into that topic. I was kind of focusing a lot more on genomics with kind of your traditional. Well, I've been very focused in my practice with cognitive stuff. Just because I came to realization my grandfather died of dementia long ago, but I watched him his last 5 years of his life. He wasn't him. He was a human being that looked like him, but he wasn't really him. If you still have your brain and you're still with it, you can be in a wheelchair and you're still grandma or grandpa or whoever you are. So the brain's really important, and genomics can really open up understanding of, do you have likelihood for Alzheimer's and dementia and all these different things. So that was kind of my focus. I then got involved with some of the functional neuro stuff. Dr. Joe Schaefer, who's created a new brain recovery technique, which is really big in Europe and is evolving every week. And we were at a seminar, and one time when he was going to come speak in Atlanta, I mentioned, oh, I'd love to talk a little bit about the genetic stuff. And he said, well, I don't know how that really relates to, and we were doing TBI stuff, so the traumatic brain stuff. And to me, once you look at the big picture, there's a huge relationship. And so what that relationship is if you have a propensity towards stroke or towards Alzheimer's or towards major inflammatory diseases, well, okay, that's in your genetics. And that's where TBI and brain injuries and stuff come into play, because that's going to be the straw that broke the camel's back. That's when suddenly you have two guys who both get a concussion. One guy can recover and the other guy suddenly has all these problems. And it's really probably his genetics and his genomics is what's going to affect that. So genomics can both help realize where are the things you need to focus on, but as well, okay, what do we do to treat this person the best?
And are there ways that you can kind of tell beforehand? Are there things you're doing?
There are. I mean, I've been doing this for several years now, and I've done a lot of different people. And I mean, the reality is we all have similarities by our ethnicity. You know, Caucasians tend to have certain problems that Asians don't tend to have. So there is a little bit of you can do some stereotyping or some generalizations of, okay, these people are kind of Irish, they have this sensitivity. It's very common that they're going to have this metabolic problem,
Mhm.
or that they might have this other problem. So
Mhm.
you don't necessarily have to spend all the money on genomics, which, by the way, I'm not talking 23andMe and Ancestry and stuff. Those are very antiquated at this point, and all of the functional stuff you want, they don't have, or they're not necessarily accurate.
Mhm.
And where that's a really big deal is you don't want false positives or false negatives. I mean, it needs to be, if you're going to spend your whole life thinking you have something, you want to be 100% sure you have what that is.
Yeah. Yep. And once maybe somebody does acquire a head injury and they are genetically more likely to suffer chronic um, issue from that, how are you looking at the genomics to then structure your treatment plan?
So really the genomics, I mean, you don't even necessarily, at this point, I don't necessarily need it. I've seen several TBI type people and brain injured people, and I
Mhm.
don't have their genetics. In fact,
Mhm.
usually when they're in that kind of state, they're already spending enough money. They don't want to go spend, you know,
Yeah.
$1,000+ on the proper genetic test. You can pretty much make observations. It really comes down to the nutrition with it. You know,
Mhm.
glutathione is the number one calmer of the brain when the brain has inflammation. So for most people, glutathione is going to be super, super important.
Mhm.
And there are SNPs of that, which you can find out. But then there's other genomics of people who, let's say, have a history of Alzheimer's, dementia in their family. They
Mhm.
usually have what we call an ApoE4 gene, which is a kind of a, if you think of cholesterol, how your body cleans itself and repairs, the apolipids are essentially how our brain does too. And in that case, there's certain nutrients like sulforaphanes and such, which help to detox the brain.
Mhm.
So if a person has a really bad TBI, honestly, most of the time, I'm going to support all those systems. I'm going to support brain regeneration. I'm going to support blood flow. I'm going to support, um, healing and recovery all together. Once you get that, and again, I've done enough of these that once you do that, you can start to realize and recognize, okay, this one's not needed. We need a lot more of this particular nutrient, though. So really, this has a lot more of the nutritional component, which I find
Mhm.
in a lot of the TBI stuff and neuro stuff is left out of the treatment protocols, or the need for it, I guess you'd
Mhm.
say.
And you mentioned a couple. You said glutathione is a big one that you use. What are some other things that you use, and is it all supplement based, or do you try to do as much in the diet as possible? What's
Yeah,
your
well, you
approach?
definitely need to address the diet because, like, for example, interleukin
Mhm.
6 is it's an inflammatory cytokine that's very related to um, diet,
Mhm.
and one fast food meal can increase your interleukin 6 for like 6 hours. So if a person is recovering from a brain trauma, be it a stroke, be it TBI, be it whatever, that's the last thing their body needs, is to have something that's going to mess up their brain for a while. So diet's obviously a very, very important part of that.
Mhm. And and you mentioned, some nationalities might be more predisposed to certain things than others. Do you take that into consideration with maybe the certain things that you will recommend to them, or?
Completely. I mean,
Mhm.
if you think a person, I mean, when I look at the nutrition for the brain itself, or my
Mhm.
brain recovery must-haves, and this isn't quite on our topic, this would be another, and if you invite me back, but
Mhm.
I always look at the things you must have for the recovery. You've got to have brain stimulation.
Mhm.
You've got to have proper nutrition, which is going to be either supporting the brain, calming the brain, or detoxing the brain. Those are kind of
Mhm.
the three simple categories I do. You've got to have blood flow. You've got to have rest. Um, and then you have to have your energy for the brain, which is really a lot of the modern stuff that is in the functional neuro world now, is like how important ketosis is.
Mhm.
Ketosis is very anti-inflammatory for the brain. I mean, it's a very specific diet. If a person's hypoglycemic, they can't do ketosis. So that would be an easy example right there, is if you've got a person who's tends to be of a nationality that tend to be hypoglycemic,
Mhm.
you're not going to be looking at throwing them into ketosis. It's just not a reasonable thing.
Right, right. Just gonna pause really quick. So you mentioned some of the supplements that you use, but could you list some more specifics that you really like to use with this?
Yeah, so like I mentioned, when you
Mhm,
have a brain injury or any kind of brain discoherence, this works for those watching. I mean, if you're interested in brain health, this could be a parent, this could be a
mhm,
spouse, this could be a child.
mhm,
This goes for anybody with brain injury. Obviously, a TBI, a concussion is a very serious one,
mhm,
but we all have these problems, honestly. And so, if you're thinking of repairing the brain, if the brain has a problem, I usually am typically looking at something like DHA, which is
mhm,
EPA DHA, kind of for fish oil, but that's more cod liver oil based and such, which is high in the DHA. And then phosphatidylserine is another really go-to. Phosphatidylserine is really helpful for people with really chronic brain stress, and we know that stress destroys the brain.
mhm,
So you take an athlete who's been overtrained and has a problem, and then they get a TBI on top of that. That system's already was weak.
mhm,
And that's kind of that again where genomics fits into understanding where was this person before they got injured in the first place.
mhm,
If you need to calm the brain, trisomal glutathione would be the number one go-to. I mean, that's really the fire extinguisher for the brain. And then a common one in the research everyone recommends, would be N-acetylcysteine,
mhm,
NAC. But NAC is really a precursor to glutathione.
mhm,
So it's a lot cheaper than phosphatidylserine. If a person's metabolics are working properly, NAC could be good. If
mhm,
they're really inflamed, NAC might be too hard on the liver or their body's not going to utilize it. So again, that's that patient care of do you give them one thing and then you shift them to another.
mhm,
Let's see, cleaning the brain. Cleaning the brain, there's sulforaphane. There's a whole bunch of other similar type products out there and enzymes that are known, but sulforaphane's probably the most famous for cleaning the brain. Resveratols go into that. There's a lot of antioxidants that go there.
mhm,
Function of the brain is the brain functioning right? I would always look at CoQ10 and then citicoline specifically, which choline is a non-essential B vitamin. It's
mhm,
very important in the body, and a lot of people's genetic mutations or problems, shall we say, or weaknesses, is they either don't make choline properly or they don't break it down properly.
mhm,
Citicoline is a version of choline that can cross the blood-brain barrier better. So when we're talking brain, citicoline is what I tell people to look for. And then the other one that I cheated just for a second there, I glanced at my computer, is low BDNF. Brain derived nuclear factor is
mhm,
like the fertilizer for your brain.
mhm,
And it's also anti-inflammatory. So then you have curcumin, which is just a high dose turmeric kind of thing. It's a better derivative of that. You've got
mhm,
milk thistle. Lion's mane is actually really big for a lot of people, and that is a genetic thing. As I've learned more about genomics, I'll have a patient who found it on their own, and then
mhm,
we run their genomics, and it's like, man, lion's mane be great. And you're like, oh yeah, I've been taking that for 2 years. I feel so much better when I do it.
mhm,
And now we know the answer in hindsight, kind of thing. And then the other for that is moderate to intense exercise. They've done these studies that show, athletes need to keep moving.
mhm.
You don't necessarily want to be sedentary. It may not be your same sport,
Yeah.
but you want to keep exercise going, and that's going to give blood flow and oxygen and all those other kind of things.
Mhm. And when so you're mostly looking, you mentioned you kind of want to see kind of genetically where a person is when they may have sustained an injury uh, or developed Alzheimer's or had a stroke, what genetically may have put
Yeah,
them
so
into that
you
position.
can use it both ways. It's
Uh-huh.
kind of like if you have run your genetics and you've spent all that money and you
Hmm.
know you,
Yeah.
well, now you know that, hey, if I get a TBI or I get a car accident or I have this, these are probably things I
Hmm.
really need to take a lot of.
Yeah.
And just be careful. At the same point, if someone's had a problem, well, then you can do the genomics almost, then it's a hindsight, okay,
Hmm.
that kind of thing. That's why I'm saying you don't have to go ahead and spend all that money
Right.
necessarily. If you get someone, there's a lot of people who do what I do,
Hmm.
who's competent. They're going to be able to pretty much surmise what your problem is going to be.
Right. And then after a patient may have sustained that injury, uh, is there an epigenetic effect then afterwards? So is there,
Completely, and
yeah.
that's when you get into like gene expression. So
Hmm.
just because you have a propensity for diabetes doesn't mean you're going to get diabetes if you
Right.
eat right and exercise right, whatever.
Hmm.
Same thing when you get into genomics. Let's talk the TBI stuff.
Mhm.
When you have that kind of, or an infection will do the same thing. By the way, you get an infection that's a really big infection. Even COVID did that for some people.
Yeah.
It fried their brain a little bit. Well, now they're different. They're a different person, and all
Mhm.
those rules that, oh, I've been eating this way for years, or I've been doing this for years, they may go out the window.
Mhm.
You know, it may be a person that, oh, I eat tons of fruit because I'm a big athlete. And suddenly you have a head injury and you express some genomic issues, and you might be really better to do keto and change your entire paradigm of how you eat.
Yeah. Yeah, exactly. And then yeah. So when it comes to then that epigenetic factor and nutrition, which one do you consider to be more important?
They're both very viable. It
Mhm.
depends on what your specialty is. You're going to find people who specialize in epigenetics and diet and coaching and everything. They're going to always blame epigenetics as the number one. Genomics, you can argue too. You're really just kind of hedging your bet versus what you need at the time because of
Mhm.
that. And then, so I guess here would be the argument: can you take nutrition prior to the injury? Well, sort of, but if you don't have a lot of brain inflammation, glutathione is going to be good for you,
Mhm.
but you can't pre-take a bunch of glutathione before you're about to get injured or get that infection.
Mhm.
Now, if you know your genomics, you might know, oh my gosh, as soon as I ever get some kind of big infection or head injury, or I see somebody having a problem, I'm going to start taking glutathione a lot more than I do
Mhm.
immediately versus wait around until someone else does it. So, you know, our nutrition needs change. Kind of like I said before, our nutrition needs will change depending on how serious the injury is and what it does to your, you know, genetic profile, shall we say.
Mhm. Can you give us an example of maybe a patient or two that you noticed maybe before you started to integrate this into your office? Um, I guess what are some of the dramatic changes you've seen since integrating genomics into patient care that weren't quite there before you were?
Sure. So where I first really started with this, and again, I mentioned Dr. Schaefer's brain recovery, which I think is a
Mhm.
really cutting edge methodology. I mean, it was actually started here in Atlanta, kind of when Dr. Mark Ellis, who I'm assuming has
Mhm.
been on this or will be,
He
he's
has,
pretty
yeah.
well known. He's a well
Mhm.
known guy. He was at the seminar with Dr. Schaefer, and he was working on another neurodiplomate, Dr. Jonathan Arkin, who was
Mhm.
there, and they were doing some neuro stuff in the back. And Joe was just kind of like, hey, what are you guys doing over there? And they explained it. And that's when he was like, huh. And he started to do his brain recovery. And that's where that was invented from, shall we say.
Oh, really?
So I got, because I knew that technique, I got some referrals for TBI and stroke and such.
Mhm.
But I then was incorporating, not that doesn't deal with this genomic stuff at all. And I got a referral from a very well known neuro guy for a TBI case that he kind of felt he plateaued on.
Mhm.
And it was very humbling because, you know, I have ultimate respect for you neuro diplomates. I just never did the program because I already had so many other things I was
Yeah.
already doing, and there's only so much we can know.
Yeah.
So it was very humbling to get referral, but it was also kind of like, well, what am I going to do? And I think and it was a successful outcome essentially. I mean, we got that other piece of the puzzle,
Mhm.
and it really was just the nutrition. It was getting the brain satisfied and calmed down on a nutritional level, which hadn't been done
Mhm.
just doing functional neurotype stuff.
Mhm. So
Um,
what are some interventions that you were able to do for that particular person?
so in that case, it's kind of like I said, that was one of my first patients
Mhm.
that I did it with. I mean, I just kind of threw the kitchen sink at him.
Mhm.
You know, we did glutathione, we did DHA, we did phosphatidylserine. We didn't do citicoline at the time, but we did the major emergency ones, shall we say.
Mhm.
And the patient didn't like it necessarily because they're like, why am I paying all this money now for nutrition? Because they never were in that role of how their diet affects them and their lifestyle and such.
Mhm.
But then they started to feel better. And once they started to
Yeah.
feel better, okay, they opened up. But we over time started to look at, you know what, let's be a little cheaper. Let's not do this one, or let's try this one.
Mhm.
And we refined it exponentially over the course of, you know, a few months, if you
Mhm.
will.
No, that's
And they're
excellent.
doing well. Another kid, which was a very hard case, which again I kind of threw the kitchen sink at, was a college level lacrosse player who had 2 concussions within 1 month,
Mm.
with actually a 3 week period, which, as you probably know and have talked
Yeah.
about, that's a really big deal when you have
Hmm.
that kind of an injury. And it really messed him up. I mean, it destroyed his college, academic abilities and everything.
Hmm.
And again, that's kind of where we started with that.
Hmm.
With someone who has a more minor, or let's say you get somebody who, they had a head injury 6 months ago or a year ago, and they're still a little having issues. Well, that's when I'm really looking at their epigenetics. We're going to talk diet and lifestyle. And then I'm just looking at what's missed. Okay, what are
Hmm.
they really not getting any of? If I get a vegetarian or even a vegan, let's say, not to offend anyone,
Hmm.
essential fatty acids are from animal products. So they're essential. Our body needs them. You can get them from other sources, but in a case of injury, you need high dose of that stuff, and it's really, really difficult to get. So
Yeah.
understanding their epigenetics, you can then sit there and say, you know what, this is where their body's deficient in, just from their lifestyle.
Hmm. And I'm glad you mentioned lifestyle. And I know you mentioned earlier with the athletes, it's better for them obviously to not be sedentary after a big head injury. What are some other lifestyle, maybe non-nutritional things that you consider pre-post injury?
Well, I would say the one is just, when the body doesn't like when the brain's not working well, and it's very
Hmm.
confusing, it's very disconcerting, it's very emotional.
Hmm.
So I think addressing or recognizing the emotional component is
Hmm.
very, very important too, because if when people are in chronic pain, no matter what, they tend to become depressed.
Yeah.
And the reason is it's just over afferentation, it's over stimulus to the brain,
Hmm.
and the brain just gets exhausted when it's already injured, and it just shut up, kind
Yeah.
of thing. And so getting them to recognize that I understand you're feeling frazzled, or a person who's this was before the brain stuff, but I had a fighter pilot years ago who had broke his back and was paralyzed from the chest down. And I mean, it really was, it was such a mental disturbance for him.
Hmm.
I wish I knew what I knew now that I did back then. I might have had more I could have helped him with at the time. But
Hmm.
again, explaining that the mental implication, the emotional implication is a huge, huge thing.
Hmm.
And then you would talk, actually, there would be another from a nutritional point of view, brain calmers,
Hmm.
things like chamomile tea. Chamomile tea actually helps to increase alpha, brain waves, and delta. It helps to calm you down.
Hmm.
Um, there's other teas. I'm just thinking. My wife is Thai. She's a tea junkie, and she's
Hmm.
always making all these different teas. I mean, jasmine teas are good, but chamomile is the one that does stand out in the research and such.
Hmm.
But just again, looking at things that someone may say, "Oh, I don't drink tea." Well, you know what? You might want to right now, and you
Hmm.
might want to get off the caffeinated coffee right now, because that's going to be an androgenic, stimulator kind of thing.
Yeah, absolutely. If you had a patient or somebody listening, maybe is a recent TBI or stroke survivor, and you wanted to kind of lay out step 1 through 10 of, kind of all the boxes they should check in order to ensure maximal recovery, like who should they be talking to, and what are some different types of therapies like genomics
Sure.
should they
So,
be considering?
the problem with the internet is there's so much data out there,
Hmm.
and there's so much bad data out there, and there's so much bad advice out there.
Hmm.
But there's also some phenomenal advice. I mean,
Hmm.
hopefully, people who are watching this think this is actually good, rational advice.
I think so.
I think step number one is realize there is no one step for everybody.
Hmm.
One size fits all. It's not true at all. So I would be very worried that people that are very definitive that, oh, this worked for me, so this
Hmm.
is what you need to do. Even if it's a doctor saying, oh, I was an athlete and I got these head injuries, well, then ask them about genomics. If they don't even know about genomics, well, okay, they're just doing this based upon their knowledge base kind of thing. So
Yeah.
I would say if you don't feel very confident in your body and what you knew, you need to see someone. You want to be treated by a practitioner. If you can't, and I don't know, that it's kind of what I mentioned in the beginning, when you get into truly understanding genomics, you can't really, none of us have the time to truly go over diet, lifestyle, exercise, do neuro exams, neuro rehab. All the therapies that are needed can't be done by one person, I would
Hmm.
argue. if it's especially if
Mhm.
severe. Now, if you're an elite athlete and you've got this, you probably have a team of people swarming on you anyway. But for that person at home, I would recommend that, yeah, they're injured and I wouldn't mess around with it. I would definitely want to go get checked.
Yeah.
I don't remember the statistics though. Is it a week and a half? If I remember, is with a concussion, you actually don't really want to push the body too much for about a week and a half.
Yeah, definitely.
You get better outcome afterwards. But at the same
Mhm.
point, I want to say it's 3 weeks, I
About
believe,
14
then
days. Yeah.
that you want to start treatment or therapy.
Mhm.
So
Yep.
that would be an important one for sure. If you have an injury that's something like that, you want to immediately just eat cleaner.
Mhm.
Just eat clean, drink water,
Yep.
stop anything bad.
Yep.
There was a funny, not quite related, but related. There was a pro PGA, very famous pro golfer who got COVID and was in the hospital, and he then ended up getting out of the hospital pretty easily, and then he went back in with COVID again.
Mhm.
And it was a very interesting case because he mentioned in his interviews, like, people, you need to take this COVID very seriously. I got out of the hospital, I ended up going back in because I noticed that beer and wine wasn't tasting right. And it was like, okay, you've just been in the hospital with a disease that can theoretically kill people,
Mhm.
and you just got out, you're home drinking beer and wine. So,
Yeah.
that's the
Yeah.
kind of common sense that I think goes for any problems and injuries. So that's
Mhm.
really all, is respect that, spend some money on nutrition, no question about it.
Mhm.
But this is why I help some people in getting their genomics done in the first place before, because then you're armed to know in the future, these are my weaknesses and this is what I need to take care of.
Yeah, exactly.
Yep.
And if those people listening wanted to find somebody who was knowledgeable about genomics, somebody like yourself, where would they even start looking?
Well,
How would
they
they
can they
find
can
you
they
too?
can find me and ask. I mean, because
Yeah.
genomics, the good thing, it's not something you have to see someone in person per se. It's a
Hmm.
test, and then you go over the test. So, I mean, in fact, in my office, if someone runs their genomics, I do them by Zoom call. Is
Hmm.
how we do our follow ups, because it's too much data, and that way they're at home on their computer, and I can
Hmm.
be at my computer and have all my references. It's easier than in person actually for that.
Hmm.
The other buyer beware is there's a lot of doctors, like any lab testing, that charge a lot more money maybe than something is.
Hmm.
The test that I use, I typically, it charges, depending on what panel, anywhere between like $17 to $2,000. I've been to the conferences with some medical doctors doing the exact same test, and they're charging 4 to 6,000 for the exact same information, the exact same outcome.
Hmm.
They're just making a bigger profit. I've never been that kind of a doctor. I'd rather help someone, they respect it, and then they refer me new people, and I get to learn more about everybody.
Right.
So it's not to sell myself, but there's good doctors around there. They're just sometimes hard to find. I would say that the doctor that wants to run everything is
Hmm.
usually not the best spot.
Yeah.
You don't need to run your microbiome, your immune system, your brain, your genomics. You don't need to run $5,000 worth of tests
Hmm.
right away. A good
Yeah.
doctor is going to know, okay, these are the most important. Now we got to rule out, and then we'll do this from that.
Right. Exactly. And so how would they then find you specifically in your clinic?
So I'm AK Doc. You can't see my
Hmm.
shirt. There we go.
Oh,
I
there it
got
is.
to trademark it years ago, but akdoc.com.
Uh-huh.
I didn't have anything prepped because, again, this wasn't a sales pitch for me.
Yeah, that's fine.
But if just akdoc.com is my website.
Mhm.
I started a nonprofit education organization a couple of years ago, which is fmdsinc.com. That's more for doctors, but we
Mhm.
schedule trainings, of different doctors from around the world to teach at. Actually, Dr. Ellis was one of the co-founders of that organization. That would be another place for that.
Mhm.
But I'm sure I can pass you some stuff that afterwards you can send on to your, anybody who's interested. They can contact you, and you
Yeah.
have my contact as well.
Yep. We
Um,
can always include
yeah.
it in the notes and send them out to people
Yeah, I mean,
once
I'm
this
always
episode
open.
comes
I
out.
I enjoy
Mhm.
what I do, but I'm happy to give people advice no matter what of what I think. And I do a good bit of that. Second opinion, shall we say,
Mhm.
with some cases that sound complicated, and sometimes I can sift through that and say, you know what, this really doesn't need to be this complicated.
Yeah. Yeah, exactly. Well, we are just about out of time, and I really appreciate you going over this topic with us today. I know I learned a lot. I'm sure our listeners learned a lot too. Super fascinating. So akdoc is where we can find you, .com.
AK Doc is where to find me. Yep.
Perfect. Well,
All right.
Dr. Whittle, thank you again for coming on today. This was great. I really appreciate it. So,
Yep. It was fun, Doc. I appreciate it too.
all right.
All
So
right.
from the Neuro Wellness Podcast.